family. Happy Tuesday to you. This is Pastor Jennifer, and I am so glad you have chosen to meet us today in the break room. I am so excited to have with us today Dr. Mary Jane Burton. Welcome to the break room.
Oh, thank you. Thank you so much for having me.
Well, thank you for coming. Dr. Burton is an infectious disease doctor and specializing, I guess, around COVID treatment, COVID vaccine. And so we got lots of questions for you today. And so I'm excited to have you with us. So, right now the vaccine is here. It is available. It is being administered. And so I've had conversations both with people who have taken the vaccine, people who haven't taken the vaccine. And I guess for those who have not yet received it, the big question is, how do I know that it's safe? Because a lot of people, know the vaccine was basically developed within a short period of time. So let's start there. How did they develop a vaccine in such a short period of time?
Well, Pastor Jennifer, you're correct. Getting a vaccine within 12 months is an amazing feat.
Mm-hmm.
But no skimping on safety occurred in the
Mm-hmm.
development of the vaccine.
Mm-hmm.
There are a few things that were in our favor,
Mm-hmm.
in the world's favor. One was this was not the first coronavirus to cause a pandemic. We've
Right.
had two others. SARS in
Mm-hmm.
2002 and then MERS in 2013.
Mm-hmm.
So even though they were able to be controlled with public health measures, there was some stages of vaccine development that started. There's always vaccine research going on.
Right.
And so we weren't starting from scratch when it came to the COVID-19.
Mm-hmm.
The second thing is that there was a lot of collaboration
Mm-hmm.
globally.
Mm-hmm.
The vaccine was sequenced very quickly
Mm-hmm.
once it was recognized and put on a website for any scientists to be able to download and begin vaccine development.
Mm-hmm.
And so no live virus was used in the manufacture of the vaccines. You cannot get COVID-19 from the vaccine because it doesn't contain the virus.
Right.
But the sequences were made available, and so there was a lot of collaboration both on the global scale as well as in our country. The
Mm-hmm.
federal government took a lot of financial risk and
Mm-hmm.
backed the companies, so they were able to conduct trials. You would never start a phase 3 study while you're finishing up analyzing a phase 1, for
Right.
instance.
Mm-hmm.
But you were able to do that because they were taking the financial risk.
Mm-hmm.
And you would never start manufacturing
Mm-hmm.
a vaccine before you had approval.
Right.
But the federal government said they would take the risk, and so you were doing all this at once instead of waiting, doing it step by step. And that enabled a very, very quick vaccine.
So in essence, a lot of the red tape was taken care of.
True.
So that what needed to happen could happen.
True.
Without, okay. So how do people know that it's safe? So we know the first question was, how did they develop the vaccine within the course of a year? But basically research had already been going on. This is a form of the SARS virus, so there was lots of research and knowledge already out there. So how do people know that it is safe for them to receive this vaccine?
The same trials that are always used to conduct vaccine research were conducted for these vaccines.
Mm-hmm.
Each of these vaccines had a phase 1, phase 2, and phase 3 study that were fully enrolled with the same enrollment numbers that have always been used for vaccine research.
Mm-hmm.
So phase 1 is just to make sure you can give the vaccine to humans. Right?
Sure.
So that's done. And then phase 2 is finding the correct dose and trying to get the right response, kind of your dose finding studies. And then phase 3 is your safety and efficacy. So the Pfizer vaccine trial was the Pfizer vaccine trial was 45, the Johnson & Johnson was 45,000, and then the Moderna was 33,000. These are the same numbers that are always used for vaccine studies. But since that time, we've given a lot of vaccine. In the United States, we're given 2 million a day, and 2 million a day, with very few adverse events reported, though all adverse events are reported. Anyone can go to the website and report a vaccine adverse event. That's always been true. And so with all these people going on, getting vaccines, 2 million a day, we've had very few reports of serious adverse events. In fact, if you look at the rates of anaphylaxis from the COVID-19 vaccines, it's actually lower than if you were to get a CT scan with contrast.
Wow.
You get more, yeah. So if your doctor recommended you get a CT scan with contrast, you would probably get it without thinking. But the risk is higher of anaphylaxis is higher with that than it is for the COVID-19 vaccines. So they're safe. They are safe.
So what are some of the most commonly seen or reported side effects at this point? And I want to say, because I know typically with any vaccine, there's going to be some anaphylaxis somewhere in some patient. It may not be, certainly not every patient, but basically any vaccine will have some responses. But what are the most commonly reported side effects right now from the vaccine?
So fatigue, headache, nausea. Some people report diarrhea. Some people report fever.
Okay.
So,
the most common side effect that I've heard is the sore arm.
Well, that too, the sore arm. Yes, you can have a sore arm. That one is the injection can be. Some people actually it gets a little red around there, but it goes away.
Okay. So how are we able to provide the COVID vaccine for free? Because I know even for our church, we partnered with a local hospital and we were able to provide those for free. So how are we able to do that?
Well, the government has purchased all the vaccines and is making it available for the people of the United States. So the government paid for that. Now that pays for the vaccine itself. As for the administration, HRSA has paid for a lot of the administration, particularly if people don't have a payment method. Some of the pharmacy partners may eventually bill insurance for people who are insured to pay for the nurse that administers the vaccine, the pharmacist that dispenses the vaccine. That may be done in some of the industry partners, but the federal government has purchased the vaccine and is paying for most of the administration.
Okay, so for the people who do have some type of allergic reaction to the shot, what typically causes that?
Okay, so the only thing that would cause anaphylaxis is if you have an allergy to a component of the vaccine. And for the Pfizer and Moderna, the messenger RNA vaccines, it seems to be an anaphylaxis to phenol or to the chemicals in the vaccine. The Johnson & Johnson's a little less fleshed out just because it's new. I believe there have been 2 cases so far, and again, anaphylaxis is because you're allergic to something that you ingested, and really anything, even a food, can cause anaphylaxis. So, people who do have a history of anaphylaxis should let the vaccine site know you're supposed to be monitored for 30 minutes instead of 15 minutes, as you probably know, because y'all have been a site.
We just did a clinic this past week.
Congratulations, that's amazing work.
We were really excited to be able to do it, and we had senior population here. We had some of our younger population here, but it was really a good feeling to be able to provide that for the people who said, I've listened to the research, I'm ready, I'm excited, and so there were a lot of people who had been walking in fear who, now that the vaccine is available, they're ready to go ahead and move on with life. So with that being said, let me ask you this. Once people have received, both doses, if they're doing Pfizer and Moderna or their single dose with Johnson & Johnson, what about their lives can be different?
Well, we still recommend, masking,
right.
When you're going about,
Sure.
masking anywhere but home, and strict hand washing, and certainly in healthcare settings, no change in the masking requirements.
Right.
But the CDC this week released that small groups of fully vaccinated people who are more than 2 weeks from their vaccination can gather without masks and even consume food in front of each other. So small groups, and a vaccinated senior adult may visit, if they don't have to travel, they haven't released travel, may visit grandchildren and children that aren't vaccinated, as long as the people in that home are not at high risk for severe COVID. So,
Gotcha.
So if everyone's healthy and grandma wants to go visit the grandchildren, CDC has given the green light for that, which is big.
It is big, because I know for Thanksgiving and Christmas, basically per CDC guidelines, it was stay home, stay to yourself, and so for a lot of people, some people have gone a year, or more without really being able to travel and visit loved ones. So this is really a game changer for people. And so right now we're basically seeing about 2 million vaccinated per day. Okay. And so how soon do we anticipate getting to a place where it will no longer be necessary or recommended for people to wear a mask? And at what point do you feel that we'll be back to where we can, go to a ball game or things of that nature, where, it's large gatherings of people? But how long typically is it with something of this nature before you get to that point?
Well, I have to say, I've never seen anything of this nature in my life.
Well, I haven't either.
So I have to have a lot of humility before this virus. So right now, about 10%. 10% of the United States are fully vaccinated. We'll just have to wait and see till we really see community transmission rates go down.
Right.
There is some concern about the viral variants that we hear about.
Right, and that was going to be my next question. How many variants are we seeing? I think I've heard of 2 so far. But how many variants are we seeing, and are those variants responding well to the current vaccines?
Well, there's 2 types of variants that we're kind of seeing. One are the more transmissible variants, okay? And that one we have in fairly high numbers in the United States, and is projected to be the most dominant strain in the United States before the end of this month.
And is it being transmitted the same way as far as like
respiratory droplets? Yeah, so some aerosols, but
so that's why the masks are still important.
So that right now, the more transmissible variants appear to respond well to vaccination.
Okay.
However, we do have what we call the antibody-resistant variants, and those don't seem to respond quite as well to the vaccine. Right now, those are not dominant in the United States, though we certainly have them and are seeing them. The thing about viruses is they're always changing.
Right.
They're always,
like we know with the flu.
Yeah.
There's a different strain, pretty much every year. So
yeah, they're always changing. So I'd like, we really need to follow the rates and make sure the rates go down, because regardless of what the dominant strain is, if the rates in the community are low enough, then the likelihood of someone getting in contact and getting ill and passing it on is low. And right now we're just not there. In the United States, we have 70,000 cases per day. We've kind of hit a plateau, much better than where we were but it's getting warm outside. People are feeling optimistic. It's good to feel better. We don't need to feel. We need to still follow guidance, though. I really do think that's important, that we still pay attention. We still wear our masks. And we still, wash our hands. I'm certainly going to still be wearing a mask when I see patients at work.
Absolutely.
I'm going to be wearing my eye protection, and I'm certainly going to be washing my hands for quite some time.
Absolutely.
I'm hopeful. I have children that will be attending college, and I'm hopeful that they will be able to transition back to on campus in the fall. I don't know. We do think we'll be able to vaccinate all the adults in the United States by the end of May, and that is we have another vaccine that should be available soon, and that will, and then there's another one after that should be available in the summer. So we should have plenty of supply to be able to vaccinate all the adults that want to be vaccinated, and then we'll roll back, and so I'm hopeful that college students will be able to be vaccinated. Don't know that for sure. We have to see how things go. But I'm hopeful that's the case, and then we'll just have to see how things go. So we're hopeful that, by the end of next year, we'll be looking to a very different 2022 than 2021. But I say that with all humility, because this virus has thrown us some turns.
Absolutely.
So, has just From the get-go, it has been something very difficult to predict. So
this time last year, there's no way we could have seen where this was headed.
No.
I remember last year going on spring break, and while we were there, everything is saturating the news all of a sudden. Everybody's grabbing all the hand sanitizers, cleaning supplies. And so we were out of town at that time, and then I don't think at that time the first case had been reported in Mississippi yet. But by the following week, we had our first case. And then it went from 1 to like 15 to like a couple hundred, and then there it went. So I don't think anybody could have really foreseen or anticipated where this has gone. Mm-hmm. And certainly we wouldn't have seen ourselves wearing masks for, a year, 2 years. So it's completely changed our approach to life, how we do things. But, everybody's doing what we need to do for the most part to stay alive, to be healthy, to make sure we keep those around us healthy. Let me ask about the efficacy rate as it relates to the Pfizer, Moderna, and Johnson & Johnson vaccine. We know all 3 vaccines are approved. They're out. They're available. But let's talk about those efficacy rates. What are they currently between those 3?
One important thing is, remember, they were all studied separately.
Mm-hmm,
they weren't in a comparative studies together.
Mm-hmm.
So it's hard to compare them because they were all done in different populations.
So it's not like an apples to apples study. It's like an apples to lemons study.
Right. There, this study was but looking at that, they're all extremely good at preventing the most important thing, which is severe disease and death. So they're all pretty close in efficacy for 90 to 100%, and like nothing's 100%, but at least 90% efficacy in preventing someone from having to go on the ventilator, someone from dying from COVID-19, and that is the most important thing.
Right.
Now then you get to whether someone has symptoms of COVID-19. It looks like in the studies that, Pfizer and Moderna had slightly higher at preventing for people from having a symptomatic COVID-19 infection. And Johnson & Johnson may be slightly lower, but Johnson & Johnson was also done later in the pandemic. It had sites in countries where we know the antibody-resistant variants were dominant strains.
Okay.
So the Johnson & Johnson had some study sites in Brazil and South Africa. So we know there might have, that may play a role in some of their overall efficacy, but they still prevented the more severe outcomes of hospitalization and death. So what I would say is, instead of worrying about which, and I'm not saying sure. My message would be, instead of listen, which vaccine is the best, which one should I get the one that's offered you. Right. I mean, this is a gift. This is a gift. So to me, this has been it's been a dark time.
Sure.
But in dark times we can always see beauty. And to me, seeing the cooperation that's coming forth and to create the vaccines and to offer the vaccines has been just a really hopeful and beautiful thing to be able to watch.
Absolutely, especially if you've lost loved ones and you've buried people near and dear to your heart, people that you love. To know. I know we lost someone here early December. And to think, wow, if she had just been here one more month, she could have gotten the vaccine. But, I look at it as those COVID-related deaths, they're not for naught, because everything we learn gets us one step closer to saving another life. So, we certainly remember all of those who have lost their lives to COVID, but we're definitely grateful to get to this place to have something to decrease the number of deaths and to help people come through it more victoriously. So anything else you want to share with us as it relates to COVID, the vaccines, new information coming out?
Well, like I said, there will be some more vaccines. We are studying, have started studies in pregnant women.
Okay.
And they're rolling back the ages in the trial, so that so children, so that we will see more and more younger people being,
Right.
younger people being. One question I get a lot of times is will the COVID vaccine be mandatory? I think before that happens, they have to have full studies completed about how long that'll be. Right now, everything's under an emergency use authorization. And so that requires a certain amount of consent before the vaccine can be given. So,
and let's talk about that very quickly, because I know for some people, when they hear emergency use, they feel like that means certain standards were lowered or certain things. So let's speak to that a little bit.
Well, the emergency use authorization was created for situations like this, where you really don't have time to do a 2-year study when you have so many people becoming ill and dying. And so you have the same safety within the trial itself. You just, the periods of follow-up that are allowed for submission are shorter. Now, they are still following these people a year, 2 years after their last dose of vaccine. So we'll get that, how long does the protection from the COVID vaccine last? We will get that data. But what you get with the 2-month follow-up is all the safety. So, because if you look at the history of our vaccines in the United States, we've never had a serious side effect that occurred more than 2 months out from the vaccine. So the 2-month follow-up was very reasonable. But instead of having a 2-year follow-up, which is how you would get full or 1 year full approval, this is created to allow us to have a mechanism to have something studied and looked at and made sure it's safe, but get to the public more quickly.
Right. And so for the people who are receiving the COVID vaccine now, do we know yet if they will need to receive like the flu shot? Typically people get the flu shot every year. I think the pneumonia vaccine is every 2 years, or
well, they do. It depends on when you get your first one. Okay. But 2 doses, certainly never more than 3 doses total.
Gotcha. So with the COVID vaccine, is this something people will take annually, or do we know that yet?
We don't know yet. They are looking. Remember, the antibody resistant variants. People are concerned, about there being breakthrough infections in vaccinated people. So they right now, studies have started looking at whether there needs to be a 3rd dose if you had the Pfizer and Moderna, or a 2nd dose if you had one of the 1 dose. So we will have that information. We just don't have it yet. So,
Sure.
So I will, right now, when 10% of our population is vaccinated, it's hard to imagine embarking on doing this all again. So let's get the other 90%.
Right. Let's get this
and then
done first.
see where we are. But that's a definite possibility, and it's being looked at.
Right.
It's being looked at.
And so for people, when you receive the vaccine, it doesn't necessarily mean you can't get COVID, but it does mean if you get it, the severity of the symptoms should be dramatically decreased.
Yes.
And we're not seeing death behind this. So
yes, it's extremely effective at reducing severe infection and death, which is the most important outcome for any vaccine. So yes, the couple of questions we don't have is how well does a vaccine at preventing asymptomatic transmission? So that's one of the reasons why that we're still having people go around with masks. We think there may be some protection for that. We're just not sure who has the best protection, or there are people that don't. So those are the some of those questions that we have to that will help.
And I guess one of my questions would be too, as it relates to testing. So if more people are getting vaccinated and the symptoms are not there, they're not pronounced, do we need to continue testing at the level we've been testing so that we can get that information? Because most people tend to get tested when they have symptoms, except there are some people whose jobs, require that on a regular basis. So I guess my question would be right now, what do we do with testing from here moving forward?
Right now, I don't think we change anything we're doing right now. Having the COVID vaccine will not make you have a positive test from your nares from that test. And there are different antibodies from the vaccine. There are antibody tests that can separate vaccine immunity from immunity by infection. So having a COVID vaccine will not necessarily make you have a positive COVID screening test.
Okay.
So right now, I don't think that we need to change anything right now at the moment.
So people should still be getting tested.
Well, they do say if you have, if you're a healthcare worker with exposure, you're no longer required to be tested unless you have symptoms. So if people have symptoms, yes,
Sure.
yes, they should continue to be tested. I'll be honest, I haven't had a COVID test yet. I haven't had any symptoms of that would, even though I saw patients in the hospital, I always had on my PPE and
right.
So I didn't get a COVID test. But I think if I ever had real symptoms, I would do it.
Absolutely. Well, it's been very informative today. The conversation has been great, and I've enjoyed hearing new information given. Is there anything else you would like to share with the people?
Please keep wearing your masks until they tell us it's not safe to do so. I promise I'm very faithful about doing that. I believe deeply that's the way we can protect others as well as ourselves. So, and thank you so much for listening.
Absolutely. And listen, if you have more questions, feel free to submit those. I pray that you guys have received great information today. For those of you who are still trying to make a decision, I hope that you were better informed now with the information that you need to make the best decision for you. And we want to thank you for taking the time to meet us in the break room. If you're being blessed by the information being shared, please invite your friends. Please invite your family. And I'm looking for you to join us next week, same time, same place. Until then, my sincere prayers that God's absolute best would be yours in every area of your life. Y'all go make today a great day. See you next week.